now is Dr. Devi Ramil. I hope I said that right, Doc. Medical expert and doctor of physical medicine and rehab. Doctor, thank you so much for being here.
Oh, thanks.
So we know President Trump is 78 years old. Anything from this report that stood out to you?
Well, generally it was consistent with what I've seen just observing him and hearing him speak. There were a couple things that I thought were not noted there. So, for example, usually at that age, people have a lot of the screening, the results which they provided, but also maybe vitamin D, some tests to look at bone density. They also typically look at blood glucose and something called hemoglobin A1C for diabetes. But they didn't have to release everything. I think, generally speaking, there's a tension here where doctors can be in two different roles. So you have treating physicians, which is who put together this report. That's someone who is the advocate of the patient. And, you know, they don't have to release everything because they have to prioritize patient privacy, whether that person's the president or not. But then you have other physicians where I might be in that role where you're really not treating the patient and you could be representing, you know, the interests of the public or anybody else. So you could be much more critical and put privacy kind of at a lower value in that case.
I do want to ask you about the cognitive testing. So according to the report, the president underwent testing it's called the Montreal Cognitive Assessment. Tell me more about that specific test.
Yeah, so there's different tests that you can use. I mean, usually people use something called the mini mental, but these tests look at different things. For example, they'll look at attention, memory, your ability to calculate, your language and speech. So they can look at different things, and actually you don't have to get a perfect score to be considered normal cognitively. Some of us, even if we're sleep deprived, may score less, so there's usually a range. But I did think it was not necessarily the one that people usually use, but I thought that it was, there's nothing wrong with it. It's just sometimes in the hospital, for example, we'll use something called the mini mental. This one can be more comprehensive, but I thought it was great that he got a perfect score. And I will say another thing, that usually, you know, we don't necessarily do these screening tests on people just because of their age. In fact, we'll look to see if they have other problems first. So if they're forgetting things, if they have speech and language difficulties, if they look confused at different times, you know, if they're having trouble driving or this stuff, that's what usually prompts you to do these tests. So the fact that he did it is probably in response to, you know, people's concerns. And just, we are in a democracy, so there's a lot of dissent, but just because people disagree with someone's judgment doesn't mean they're cognitively impaired.
And of course, he did bring up Biden as well, so I'm sure that was a little bit, that played a role as well. I am curious, how difficult is this test?
So some of these tests, I mean, if you are cognitively intact, generally you should be able to do well on these tests. That doesn't mean you'll get a perfect score. So that's where the difference is. But they should be doable enough. So a regular person who is doing well cognitively should be able to do well on the test. This isn't something like trying to take the SAT where you have to maybe study or prepare for it. You know, you should be able to do well, but you may have differences depending on whether you're stressed out, whether you're distracted. Sometimes medications can affect things, but his medications are generally benign and stuff. So.
The president was at Walter Reed Hospital. The tests were done on Friday. It took several hours. We talked about his cognitive capabilities. What about the annual physical?
Well, one thing I did notice is that the term normal is used a lot. So that actually has two different meanings, where normal could be there's no abnormalities, right? But it could also mean average. So that takes into account, you know, your age. So if you're older, you might have some things that look a little bit abnormal, but it's normal for age. So sometimes you want to see the raw data to see what exactly does it mean. That's not always there. It's given for certain things. Sometimes, too, with medications, you know, looking at risk factors, like you might want to have the dose to see, well, why was this medication prescribed at this dose? But generally speaking, the purpose of all of this, if you are not the treating physician, would be to see, can this person do the job? That's really, at the end of the day, with or without reasonable accommodations, can this person do the job? And I thought that the tests actually reflected that, and so did the report.
I also want to ask you about the Pope. He made an appearance this Palm Sunday. He just was released from the hospital 3 weeks ago from double pneumonia. How long will it take him to fully recover? Again, I believe he's 78 years old.
I think he's a little bit older than Trump, but the thing is, yeah, it's the hospitalization that could really kind of weaken him. So we usually think if someone's out of the hospital, they've made it out of the woods, but not necessarily, because the complications of hospitalization, the immobility can all have its effects. So it can take some time, but the fact that he is going to events and doing this is actually very positive. He's been using supplemental oxygen, I think, because he had that double pneumonia and stuff. But There could be different reasons for that. You know, as you're pushing yourself, it's like exercise, like for all of us. So if we're exercising, you know, we breathe more rapidly, we do a lot of things to account for it, but maybe our bodies can take that stress. But somebody who's debilitated may, you know, under all that physical stress, it may be too much of a strain. So having that oxygen can help relieve that.
And I just want to make a correction. The Pope is 88 years old. So is this pretty typical for the recovery to be this quick, where he's already outside greeting the faithful?
Well, it's a very positive sign. So it all depends on how the person's baseline health was. So somebody who's doing really well before they got sick can kind of bounce back sooner.
Sure.
Somebody who's already debilitated can have a problem. He also had some kidney issues, so that can be another factor as well. We don't know exactly what that's from, if it was from an infection or from medications or something else, but it's all very positive.
I have to say, with the Pope being 88 and the president being 78, their energy is incredible to me. I know people half their age who can't keep up. Dr. Davy, thank you so much for your time.